so much for joining us in part two of our series, Dmitry. Appreciate you being here.
Thank you for having me. It's my pleasure.
Absolutely, absolutely. So I know we're going to do a lot today, and
Mhm.
this series is building on what we did with JT in our first part of the series, where he outlined what the sleep report looks like, and really, kind of what, um, from a high level to expect at a sleep study.
Absolutely.
So in part two, you're going to pick up the ball and run with us today. And we're going to really prepare parents a little bit better for the experience.
Yes,
And then you're also going to give us a tour of the sleep center.
I will absolutely do that.
So
Yeah.
exciting. So before we get going, would you mind just telling parents a little bit about you and what you do?
Sure, absolutely. My name is Dmitry Spektor. I have been in the field of sleep medicine for 26 years now. I'm currently the sleep lab operations manager for pediatric sleep specialists in Texas. And we also have offices in Colorado with 3 locations in Denver, in Colorado Springs, and in Loveland. And you can get more information on the company at pediatricsleepspecialist.com. And my previous experience includes working for Memorial Hermann here in Houston at the Memorial City location. I was the lead sleep technologist there for both the pediatric and the adult sleep lab. And other previous pediatric experience, I worked at Children's Hospital Los Angeles as well.
Oh, wow. But that one was busy.
It was very busy. It's very busy.
Yeah.
It's one of the top cystic fibrosis centers in the world, actually. So we saw patients from all over the world over there.
Wow. That's cool.
Yes.
That is cool. Okay. So we were talking offline, and let's go ahead and set the expectation because I was a little surprised by this. And
Mhm.
in our world, because of, the amazing Kevin Boyd, in our world, 9 years old and up are geriatric, is kind of how we term them.
Sure.
And, we really focus on 0 to 2 is really where you want to grab them that first 1,000 days, but
Right.
6 by 6. So 6 is kind of, it's not that it's too late, but we want to handle it before
Mhm.
then. But when it comes to how we approach children in a sleep center, your, it's not a cutoff, but your line of how you work with them is a little different, correct? As far as billing is one thing, but then mentally
Absolutely.
how they work is different.
Correct. So as far as billing is concerned, children 6 years and up are billed as adult sleep studies.
That still blows my mind. Yep.
Um, but that being said, really developmentally, from my experience, that change really happens around 4 or 5. At a time where you can really talk to your kids and really explain things and where they can understand what's happening. I
Mhm.
feel it's around 4 or 5. So what I'm going to focus on today is really kids younger than that. And
Okay.
as well as kids with developmental delays, any kind of sensory issues, and autism spectrum disorders, that kind of alters the age range a little bit because, you're going to run into some issues that are not age related.
Right. Right. Okay. And that totally makes sense.
Mhm.
So let's go ahead and just dive in before we take the tour and let's talk about what parents can do, maybe some of the do's and don'ts and how they can prepare their
Absolutely.
child for an evening at the sleep center.
Absolutely. So, ideally, to really ensure a great sleep study and a good experience for your child, you want to start preparing really almost as soon as you make the appointment. So,
Okay.
a couple weeks out, a month out, start mentioning that you're going to go on a trip. You're going to spend some time away from the house. You're going to go. Eh, you know, you can say doctor's type office, but really start talking about it. There's a million pictures on Google that you can find. If you just
Right.
Google pediatric sleep study, I would
Okay.
suggest finding the pictures where the kids are laughing, they're smiling, maybe pictures with parents. And that'll kind of give an idea of what to expect as far as what sensors are put on and how involved it is, because it's really involved study. There's a lot of
Right.
wires, there's a lot of sensors.
Yeah.
The one thing to stress is it's a completely painless procedure. Kids that don't like shots, there's no shots
There's
here.
no shots.
No shots. There's no needles involved. So it's a completely painless procedure. So just to show a little bit, most sensors look like this one here, and it's a
Okay.
little cup
Oh, it's so tiny.
with a long wire attached
Okay.
to it. And, one end will get plugged into a patient interface box, and one end will go on the patient. And these have a little conductive paste in them, and they're taped onto the skin. Like so.
Okay. And they
Okay.
feel nothing, right? There's no currents or anything that they feel. They'll just have it stuck on it.
Absolutely not. Absolutely not. So our bodies produce electrical impulses when muscles fire, brain waves are all electrical impulses. And ultimately, that's what we're looking at when we run a sleep study.
Okay.
Thing you can do is you can ask your sleep lab for some samples. For example, we are more than happy to give out a couple wires, and the biggest issue we normally have is this sensor right here. Okay.
Ah,
It looks
yeah.
like an oxygen cannula. However, there's nothing flowing through this.
Okay.
This is what we use to monitor breathing and carbon dioxide levels in children. And this does go in the nose.
So I could see why that one they would not like.
Correct. Like I said, you can get samples. Ask the sleep lab if they can give you something to practice with.
Okay.
The more you can expose your child to what is to come, the better the outcome will be.
Makes sense.
Okay. And if for some reason the sleep lab is not willing to give you at least the cannula that goes into the nose to practice with, they're very cheap on Amazon. Ultimately, the biggest problem is the part that goes into the nose.
Sure. I mean, I'm an adult and I wouldn't be excited about that. So I can just imagine.
But it is a little bit easier to explain to you why we're doing these things. So
right.
So ultimately it's exposure. The more you desensitize the child to what's to come, the more comfortable they will be. You can also ask to take a tour of the sleep lab prior to your visit.
Okay.
That can be very helpful, especially for children who are apprehensive about going to the doctor. That is extremely helpful. The other thing you can do is practice, putting on Band-Aids, treating cuts and scrapes. If your child usually doesn't like Band-Aids put on, they're probably not going to be happy with the sensors that we put on during the sleep study, because it's ultimately a ton of Band-Aids.
Right.
So you can practice with that. So again, it all starts preparation before the sleep study. Now, for kids who are really, really young, like 0 to 1, you're not really going to do a whole lot of preparation because there's not a whole lot you can explain.
Right.
But once your child starts becoming verbal and they can understand certain things, you can start explaining as much as possible. I find that usually is great. With my own son, we do that all the time before we go to the doctor, any kind of new specialist, whether it's a dentist or an eye doctor, we're always talking about it. There's a ton of tools, in forms of educational cartoons you can watch also that will show going to the
YouTube,
doctor.
Maybe.
Absolutely. One of my favorites is Daniel Tiger.
Daniel Tiger.
And they have multiple scenarios, from potty training to going to the doctor and other things you can find. But ultimately, it's whatever you're comfortable with and how you want to talk about it. Now, when it gets closer to sleep study time, for example, about a week before, you want to try and have as consistent of a sleep schedule as possible. Now, you really want to do that always, but especially preparing for a night away from home at a sleep center, you want to ensure that there's some sleep for us to record.
Right. Okay.
Because it is ultimately a sleep study. So a consistent sleep-wake schedule really helps out a lot.
Makes sense.
Now, one big misconception that I've seen and is some parents will skip a nap. For kids who are still napping, they will skip a nap in preparation for a sleep study so that their kid is more tired. That is a big, big don't. Overtired children will stay up. They will not be happy through the setup process. Ultimately, you don't want to alter your routine as much as possible. Stay consistent. Now, on the day of the sleep study also, you want to make sure the child is bathed before you come in, and without any lotions and any hair products.
Okay.
That will make things very difficult on us as far as digging through the gel in the hair, or trying to get a tape to stick to lotion.
Right.
Virtually impossible. The other thing is parents who have had sleep studies and who have been diagnosed with sleep apnea, and if you're using a CPAP machine, make sure to bring that to your sleep study with your child. You don't want to be snoring all night next to your kid.
Right.
The other big thing I want to mention is sleep labs do not disperse any medication. So any kind of medication that your child needs to take, you should bring with you. Okay. And doubly important for kids with asthma or kids with seizures, you really want to make sure you bring the rescue medications to the sleep lab.
Right.
As far as what else to bring with and how to dress your child, the best, the easiest thing for a technician to work with is a two-piece pajama that is loose fitting. Pants are better than shorts because pants help hide the wires a little bit. So it helps us keep everything contained.
Okay.
Tights, gowns are a little bit harder to work with. So the best thing is just regular old two-piece pajamas with a top and a bottom.
Okay. What about things like a pillow or a certain stuffed animal or something like that?
I'm glad you mentioned that. We encourage to bring as much as possible, and whatever will make your child more comfortable, bring it with. As long as it's not alive, you can bring it with you.
Okay. Gotcha.
Pillows, favorite blanket, a little comfort object, whether it's a blankie or a stuffed animal, anything like that is absolutely fine.
Okay.
If your child, has an iPad or anything like that to distract them during the procedure, the setup procedure, you can absolutely bring that. Some labs will have TVs in them. We don't, because we like to encourage good sleep hygiene. So we do not have TVs, but if a screen is what it takes to distract them and to get them there through the hookup, that's okay.
And usually what time-ish do they arrive?
So we run sleep studies from about first arrivals at 7. We generally stagger patients about half an hour apart. So you'll arrivals anywhere between 7 and 7:30. And wake up time in the morning is between 6 and 6:30 in the morning.
Okay.
And the reason we ended that early is because the technician is at that point working about a 12-hour shift plus.
Yeah, they're gonna be tired. Yeah.
Right. So there's only so much that we can push a person to do.
And I think we learned in JTs that there's only a certain number of patients per technician as well, right? Because the technicians have to monitor constantly.
Absolutely. So Children with who are a little bit more complex, we will run those at a 1-to-1 ratio. So autism spectrum disorder, neuromuscular disease, seizures, anything that requires undivided attention from the technician, we will schedule those at a 1-to-1 ratio. The more general sleep studies, they're generally run at a 2-to-1 ratio, but never more than 2 patients to 1 technician.
Which makes sense. Yeah,
Absolutely,
based on just what he showed us, that would be 2-to-1 would stress me out. But I
right.
can see how you could possibly do it if you understood it and you had enough experience. But
Right.
I could see that.
Yeah.
And then they're in individual rooms, right? This isn't like one
Absolutely.
big giant barn. Everybody gets a cot. I mean, it's
No.
so the parents can sleep with them in their own little kind of habitat, right?
Correct. So we have the way we have it set up, and again, I'll walk through the lab and I'll show everything. Our setup is we have separate bedrooms. There's a patient bed and a bed for the parent in the room.
Okay.
We have bathrooms in each one of our rooms. Now, that is not necessarily standard. It is quite common to have a shared bathroom for all the rooms in a sleep lab, but it's generally very close by to the bedroom itself.
I would think with tiny people that's really handy because
Absolutely.
some of them are a little hesitant of other people, so that would help keep the experience calmer.
It's also the American Academy of Sleep Medicine standard that all rooms have a bathroom within 75 feet of it.
Okay.
And most are much, much closer than that.
Okay.
75 feet can seem
It's a long way. It can be, yeah.
But most sleep labs have either bathrooms directly inside the room or very close by. Now, some will have showers, some won't. We do have showers in our lab here in Houston.
Okay.
But some labs will not have showers. So be aware of that. I find that most prefer to go home and shower out anyway afterwards.
Yeah, just bring your tiny people prepped and ready.
Right.
What about things like snacks? And granted, mine are older. I'm thinking back. There was always a snack and a water right before bed. Can they bring those kind of things?
So yes, you can bring anything you like. You can whatever they normally do on a regular basis. So our goal for the initial sleep study is to see the most typical night sleep that we can.
Okay.
So we
whatever it takes to get him there.
Absolutely. So the goal is to establish a baseline. So we don't generally address, like, even if a technician sees some bad habits before you're going to bed, we won't address that. We'll make a note, and then the referring provider or whoever the patient is scheduled to follow up with, they will see that that's what was happening, and they will address those issues at that point. But the goal of the initial sleep study is to get that baseline, to establish, what's happening during the night, how long is it taking to fall asleep, how often are they waking up, what is waking them up, what is happening before they get into bed. And all rooms have video cameras in them, and they are recording. And we start that recording from the moment that you walk into the sleep lab. Okay. So that way we can kind of assess the bedtime routine that happens a little bit as well.
And that makes sense. That makes total sense. And then, so how does this, before we go into the sleep center, the labs itself, how did your approach, this checking them in, setting them up, differ from, one child to a child that's perhaps on the spectrum?
So it's really a very, I want to say, kind of informal atmosphere, and I'll show you. Generally, there's some decorations on the walls, that are kid friendly. It does not blatantly look like a doctor's office. Okay. Nice. And the technician greets the child at the door. It is ultimately up to the technician to establish that rapport. Now, again, I highly encourage a sleep lab visit prior to the sleep study. If you anticipate that your child will be anxious about the procedure and about new places in general, uh, come in during the daytime, have a walkthrough. I don't know any sleep labs that would refuse that. And if they do, you should probably look elsewhere for your child's sleep study. Um, that always puts them at ease.
Yeah. Well, I mean,
Because
the unknown is scary, right? Especially when you're tiny,
absolutely,
but for all of
absolutely,
us, it can be scary.
mhm, absolutely. And the parent, if you want to, bring something to the lab beforehand so that your child finds it there, that can be helpful as well.
Oh, that's cool.
Um, so really anything that you want to do to make your child more comfortable, everything is fair game. We
Right.
ultimately want to do our best to try and get the best recording we have and have it be as, the least amount of stress for your child as possible.
And I know this is only going to be to a tiny group of our listeners, but I'm really stretching trying to think of scenarios. But you have two tinies, let's say they're two
Right.
and they're twins, and
Mhm.
they're used to being together, but
Okay.
only one's getting the sleep study. Could the parent bring the other one if it helps calm them down? Or is that okay? That could disrupt it. We got to figure something else out. Have you had
So in
cases
that,
like that?
absolutely. So those are, on a case by case basis approach.
Sure.
We don't rule anything out. Generally, the setup is, one parent stays with one child.
Okay.
Now, if more than one child in a family is having a sleep study done, two parents will need to come and stay. So you need to have one child and one parent per room.
Makes sense.
Now, if the child is used to a sibling being in the room with them, you can certainly ask the lab if that would be acceptable. And patient acceptance policies will vary slightly from lab to lab. For example, we require a parent to stay with anybody under 18. Some labs may require a parent to stay with anybody under 21.
Okay.
And that is strictly
Based on
facility
the lab.
based
Yeah.
policy. Certainly under 18, a parent will always be required to stay
Makes sense.
unless it's an inpatient study and the patient is checked in at the hospital.
Hmm. Okay. Oh, wow. I didn't even think about that. So if that's true, they could just wheel them down, but
Right.
there are
So
cases for that.
absolutely. So there's two differences in sleep labs. There's something what we have here, which is a freestanding independent sleep lab, but then there's also hospital-based sleep labs. Now, uh, even hospital-based sleep labs, just a routine sleep study will be an outpatient procedure. So it's not going to vary much from a independent sleep lab, a freestanding one. They also cannot administer any medication, uh, even though they're in the hospital. It does not
Right.
have a sleep lab.
Okay.
Now, another thing that is sometimes done is patients who are inpatients at the hospital will have sleep studies done bedside on the floor.
Oh, okay.
At that point, they're checked into the hospital and, parent is not always at bedside, which is okay.
Okay. Got it. All right. Well, I think we have some good, some really great do's and don'ts for parents. They know what to pack. They know how to prep the child. If you're ready, let's go into the sleep lab. Okay.
Okay, Brett. So this is our front door. And I'm just going to walk in as if I'm coming in for a sleep study. We have a reception area here. So you generally will not spend much time in a reception area. In most sleep labs, the technician will greet you at the door and show you back to your room right away.
Okay.
If several patients arrive at the same time, may need to wait in the waiting area for just a few minutes. This is not a place where you will spend much time.
Okay. So again, not like a doctor's office.
No, no, no.
Yeah.
There's no waiting.
That'll help kids. Yep.
Correct. If there's one technician on duty, you will only be one of two appointments. If there's, we have 4 bedrooms here, so if we're running more than 2 patients, we'll have 2 technicians on duty.
Okay.
Okay. And then as we walk through, this is a pretty typical setup where this is the technician's control room.
Mhm.
And this is where we monitor from.
Okay.
And it usually is in close proximity to the reception area. Okay. And the patient rooms, there's our little
The little monkey.
jungle animals here on this
Mhm.
wall. And the patient rooms are generally very short distance from the control room, just so that we can get to the patient quickly if needed. Okay.
Sense.
This is the way our room is set up. So again, we have a restroom right in the room
Mhm.
with a shower. We have our patient bed.
Okay.
And we do have safety rails for the younger children. And we have a cot for the parent to sleep on.
I like how
Now,
close it is, though. That's got to be comforting to the child. I was thinking it'd
absolutely.
be across the room. That's awesome.
No, no, no. So most rooms are fairly cozy with not a whole lot of room to spread out. This is actually, pretty standard size room for a sleep study.
Okay.
So yeah, the parent is right next to the child. Now we do have cribs as well. We can roll a crib in if for the younger kids who are still in cribs. We will generally swap out the cot for a crib, and then the parent can sleep in the bigger bed.
Okay.
Okay. Now next to the bed, generally you will have some equipment.
Mhm.
Okay, and this is the recording equipment. So we have our recording equipment here. All the sensors plug into a box that looks similar to this.
Okay.
We use the Philips Alice diagnostic system,
Mhm.
but ultimately the setup is very similar with whatever system they use. And then there's a CPAP machine usually as well, and that is for treatment of sleep apnea.
Okay.
Okay. Now we have also an exam table in this
Mhm.
bedroom, and this is so that we can see patients during the daytime in clinic.
Ah, okay.
Okay. Now, some sleep labs will have these. Some sleep labs will have Murphy beds that convert to exam tables. So there will be slight variations, but this kind of gives you a general idea of the setup of the room. Now, I did mention there's a camera,
Mhm.
which will record all night long. It does record video and audio.
Oh, okay.
Okay, so the technician can generally will hear you all night long. So you can, if there's anything you need during the night, you can always call the technician, and they will come in and help you out.
Okay.
And there's also intercom systems to where the technician can talk to you as well. And that is basically it for the tour. It's very simple.
It is very simple, but I mean, you could tell, especially if the lights were dimmer, I could see
Mhm.
how, okay, it's not quite as scary as a doctor's office.
No,
The
and
parent getting to be right there, I'm sure that's
correct,
got to be very reassuring.
absolutely. And we are able to dim the lights. We do have a dimmer switch
Yeah.
to where if
See,
somebody's
that's
light
good.
sensitive, we can turn it down and work in a little darker environment.
Yeah. That's what I think, especially, for kids on the spectrum or something like that,
Absolutely.
light
Hmm.
sensitivity. I like that. So, okay, so you come in, you get checked in, and then how long does it take typically to wire up a child?
So it will depend on the child.
Of course.
For the, for somebody who's cooperative, it can take anywhere from half an hour, 45 minutes. For somebody who's a little less cooperative, it can go to an hour plus.
Okay.
Just also, super curious kids that ask a lot of questions,
Right.
will take a little bit longer, because the last thing I want to do is rush a child during the setup. If they're asking questions and they're involved, that's always a good thing. They're always going to do much better if they're involved. And personally, if I'm running a sleep study, I try to get the kids as involved as possible in what I'm doing, whether it's helping me put the little stickers on them, the sensors, to plugging them into the box, to letting them put, especially the cannula. I always like to let them try and put it on themselves. It'll tickle their nose a little bit, but they're in control at that point. So
Right.
for kids,
Which makes a huge difference.
Control is a huge thing.
Yeah.
So the more control you can, or the more perception of control that you can give the child, the better the outcomes are.
Yeah, I agree with that. That's kind of the goal of life, right? That's parenting.
Absolutely. Absolutely.
Yeah. And then, so if you would walk us through the morning. So
right.
6:30, you go in, we wake them up.
Mm-hmm. In the morning, the technician will determine, the best time to end the study. So usually it's not set in stone. So it'll depend on how well the child has slept through the night, how well they're sleeping towards the end of the night. If it's, 5:30, and I see that, the child is really struggling, they're not sleeping, they keep waking up. And if we have enough data, I will go in and I will say, hey, they've been awake for a while. We have enough data. Why don't you go home and get some rest?
Okay.
Now, if there was a really long wake period in the middle of the night, and then they're sleeping well towards the morning, we will try to let it run as long as possible, just so that we can get the most data that we can from the sleep studies. So again, 6 to 6:30 is really just a rough estimate. I've run studies to 7:30 before, and I've ended studies at 4:30, 5 o'clock before as well. So it can fluctuate a little bit, but general rule of thumb is about 7:30 check-in, sometimes even a little earlier, sometimes even 6:30. Okay, and that's just so that you can get to the lab, and so that we try to keep things as not rushed as possible.
Right. Makes sense.
When you come in here, I want to let you settle into your room. I want to let you get comfortable. I want to let the kid explore a little bit. Climb all over the bed. Get comfortable. Wash face, brush teeth, whatever you do to get ready for nighttime. Get all of that out of the way and just get comfortable and start to wind down.
Which makes sense.
And that's why, early arrival time. Now, if there's some paperwork to fill out, you may be asked to come in a little bit earlier. The way we do it is we like to do most things through a patient portal. So we send everything out beforehand, and even if the paperwork's not filled in prior to the visit, it's very easy for the parent to access the portal once they come in from a phone or from a tablet, whatever it may be. If there's physical paperwork to fill out and it's given when you arrive at the lab, you may be asked to come in a little bit earlier.
I have to say, I think I'm spoiled, because of my history. I'm in hospitals and doctor's offices so often. Anytime I have to go somewhere new and they hand me paper, I just kind of I don't know what to do with this. Do you have a portal? Do you have something I can type on? Because it's just so much easier.
Right. Absolutely.
Not gonna lie, it's just so much easier.
I think we're all going the route of, embracing technology as much as possible.
Yeah.
Just even AI involved in sleep study analysis now. So,
oh, wow. Oh, that's wild.
Yeah.
Oh, I can't wait to do a follow-up on that.
Absolutely. JT is a great person to talk to about that. He knows.
Oh, yeah. He's got his finger on the pulse.
He's always at the forefront of technology.
He is. And for those who are in the area, it's actually JT's podcast comes out next week. Um, and it will be too late for you, but there is a conference next week, and JT will be at that speaking at it.
Correct. Yes, he's speaking at the Texas Society of Sleep Professionals annual meeting. I
Yeah.
unfortunately cannot attend that one, um, but I'm hoping that his talk will be recorded so I can catch it afterwards.
Yeah, I've heard him speak. It's great. He's such a good speaker, and obviously everybody listening to this now knows as well because they got
Okay.
introduced to him in episode 1 of this series. So, at the end of every episode, usually, I hand it back to you, our guests, because you are the experts, and let you leave with final words. Do you have some final words that you could leave with our parents?
Prepare, prepare, prepare. That's all
Kind of
I can
figured
say.
that's what it would be. Yep.
Yes, you cannot prepare too much. It can be a very simple procedure, but it can also be a very tough one because there's about 20 of these plus that go on, as well as a couple belts. There's a pulse oximeter to look at pulse and oxygen levels on the finger. For the younger kids, we'll put it on the toe. So when we say wired up from head to toe, we literally mean
You
from
mean
head
it.
to toe.
Yeah.
So the more you can expose your children to really have it be familiar to them, the less anxiety, less apprehension they'll have when they come in, and especially the kids that are old enough to understand. Show
Right.
them pictures, get some wire samples, and just start gradually introducing it a month before, a couple weeks before, a week before, a couple days before. Remind them that, hey, you remember we're going to go on this trip, we're going to spend the night out, make it fun for them, make it like vacation.
Yeah. Oh, I like that. And it's funny. What I was just had it popped in my head too. I'm sure other parents have done this, but you talked about put band-aids on them, right? So they're used to
Yeah.
having that.
Mm-hmm.
If you've got some yarn, why not have a little yarn stick out so they can get used to something like the wire dangling? Because
That is an
that's got to
amazing idea.
that's got to be uncomfortable, especially for a child with sensory. That's got to be a hard thing to get used to.
Absolutely. Absolutely. Kids that have trouble when you touch their head, the more you can prepare that, the better, because the majority of the sensors do go on the head and on the face.
Oh, that's good to know. Okay. Well,
Yeah.
there you go. Now you know where to put the band-aids.
Absolutely. Yes. Yes.
Awesome. Thank you so much for answering these questions, giving us great info, and for the tour. Yeah, for so many
Oh,
of us, we've never seen the inside, so it's really, really helpful as a parent to know what you're walking into.
my pleasure. Thank you so much for having me. And I hope that this really relieves some stress for parents preparing for a sleep study. And, hopefully what I said resonates, and it'll make it easier for the technicians who will be running the studies as well.
I think so. Yep. Thank you.
Thank you, Rebecca.